Hello, welcome to Jenna's Health Promotion Talk Show. So today I wanted to take a look at a national health promotion coalition in Canada, specifically Canadian Doctors for Medicare. A little disclaimer, as a white settler woman who leans very left politically, I take in and filter information in a certain way. I'm on a constant journey of learning and unlearning, but I'm human, I have blind spots, and I can think Eurocentrically. Please keep this in mind as I proceed through the analysis. Now, who are the Canadian Doctors for Medicare? They're a national alliance of physicians and medical students working to strengthen and protect the country's public healthcare system.
I know what you're thinking. What's wrong with our public healthcare system? Why does it need to be protected? I'll get into that later.
So this organization has a vision of a healthcare system that is universal, publicly funded, high quality, equitable, sustainable, accessible, and evidence-based. We believe that Medicare must be reformed, but that reform must take place within the public healthcare system so it benefits all Canadians. The group participates in advocacy, education, and collaboration to meet their objectives. And if you happen to be curious, their most recent list of recommended reforms include team-based primary care, pharmacare, which means that medications will all be paid for, single entry specialist referrals, home care, and health human resource planning.
Clearly, we have a shortage of everyone, but it's impossible to get into medical schools or even nursing schools.
So why would we need an organization like this one? Well, in May 2006, there were some sneaky little discussions about implementing a two-tiered healthcare system in Canada. And this would allow people to buy private health insurance for medical treatment. A key concern of the Canadian Doctors for Medicare was that this would degrade our public healthcare system and result in longer wait times and lower quality of care for those who can afford to buy the fancy insurance. And since many healthcare professionals would choose to go private, why not get paid more? Fantastic. Pay off your debts? Great. But this would really decrease the resources in the public system. Now, a key figure in the Canadian Doctors for Medicare is Dr. Danielle Martin, who is a U of T alumni. Shout out to her. She founded the Canadian Doctors for Medicare during her first year of practice as a family physician and stepped down from leadership in 2013. Today, she's the Vice President of Medical Affairs and Health System Solutions at Women's College Hospital in Toronto. Dr. Martin has been highly visible in the media, including publicly debating former Canadian Medical Association presidents and other pro-private proponents.
I believe there's a video on their YouTube page. It's like, destroys pro-private argument. I like the energy in health promotion.
Dr. Martin urges bifocal vision, which means from the micro to the macro in health policy. Now, it's been quite a while since this organization was founded. It seems like there's still a great need for organizations like this to exist. Some have discussed our healthcare system as being encroached by privatization. For-profit companies are taking over more and more of Canada's healthcare system, often with the support of governments in Canada's provinces and territories. The complexity of Canada's federal system that leaves much of the responsibility for healthcare to the provinces and territories has helped to hide these developments, while also creating considerable variation across the country. This steady privatization has had serious consequences for access to and support for the public healthcare system, while embedding profit and for-profit managerial techniques to healthcare services. I saw this quite a bit in my previous role, actually. A lot of technology companies are getting really intimately involved in the healthcare system. It's contracted out, like our hospital will contract out to a tech company to do this project. You can definitely debate if that counts as privatization. It brings up a lot of questions, I think. So I wanted to share a brief history of Medicare in Canada. Universal insurance coverage of basic medical services was implemented in the 1950s and 1960s. Before then, being treated by a doctor required money. Now Medicare is seen as a defining characteristic of Canada. People like to kind of flex on the US, whatever. It wasn't always there. And in fact, it really hasn't been around for that long. Tommy Douglas, who was Saskatchewan's premier at the time, was a key player to get Medicare implemented, and he faced major backlash. There was a physician's strike that almost ended it all. So bringing it back to health promotion. Health promotion is defined as the process of enabling people to increase control over and to improve their health. Health is seen as a positive concept, emphasizing social and personal resources, as well as physical capabilities. Therefore, health promotion is not just the responsibility of the health sector. In my view, the Canadian Doctors for Medicare advance health promotion in the nation as they work towards increasing healthcare resources for the public, irrespective of income, lobbying the government, and confronting industries and individuals that wish to privatize healthcare are acts that recognize health promotion as a shared intersectoral responsibility. We can also connect it to the social ecological model, which sees the interaction between and interdependence of factors within and across all levels of a health problem. It highlights people's interactions with their physical and sociocultural environments. You have interpersonal or individual factors, interpersonal factors, institutional and organizational factors, community factors, and public policy factors. The Canadian Doctors for Medicare operate in the public policy domain in the model. Arguably, implementing their recommendations for public policy would promote health in the other factors. Just think about if pharmacare was implemented, how that would change how hospitals operate, how individuals think about their health.
Like you'll be able to take whatever medication you need. Like, what a concept.
So it's a bit of a reach, but I also wanted to connect it to theory of reasoned action. In the spirit of Dr. Martin's bifocal thinking, I wanted to look at the theory of reasoned action in the context of the government performing health-promoting behaviors. The government can be thought of as an entity that does not have the intention of performing a health behavior, in this case, protecting and improving our public healthcare system. The Canadian Doctors for Medicare try to remedy this by changing the attitude and subjective norms of the government and wider public through advocacy and education. They collectively release press statements, post on social media, appear in news segments, and disseminate research findings to advance their goals. I think it can do a lot to have these little micro messages that contribute to a larger conversation. It normalizes it. So while there are a lot of strengths of the organization, I did have a few critiques. Historians have pointed out that there is a distinction between socialist medicine, government-run programs of universal access based upon salaried multidisciplinary teams that focused on preventive care as much as curative interventions, and the universal health insurance, which for critics was maybe just a way of funding medicine without changing the fundamental nature of medical care or addressing the real social determinants of health. While at surface level, the Canadian Doctors for Medicare organization aligns with health promotion principles, a deeper look may overestimate the foundational benefit of the universal health insurance system. Health inequities persist with the current system, large ones. To the group's credit, though, they admit that the public health system is in need of reform. And I would agree with them that the current system is better than a fully private system or a public-private system. Another weakness of the organization seemed to be the lack of consideration for intersectionality, including non-citizens. We hear like Canadian. Well, what about people who are traveling or undocumented people? I believe building relationships and partnerships with health organizations promoting the health of oppressed communities could help gain support for their causes. And to be fair, the group has been trying to integrate anti-oppression work with their health justice book club. In some press releases, they do touch upon health disparities for racialized communities. One final note. When talking about the history of Medicare and medicine in Canada, it's important to remember that some communities did not have access to treatment due to racism, discrimination, abuse, and we have to be careful not to whitewash the history of health. So the research question that arose from this project was, what is the effectiveness of media advocacy as exemplified by the Canadian Doctors for Medicare in influencing policy change in the context of health promotion initiatives, and how do various media platforms and strategies impact the outcomes? Thank you for listening and take care.